contain the spread of the virus. We have to focus on the epidemiological investigation and extend the scope for the large-scale screening and the medical service. We also have to avoid gathering and do what we can to provide supply and daily necessities to the local residents. And I believe the media attach great importance to the epidemic situation of Guangzhou. Thank you very much for your hard work. And today, at your request, we have invited the Deputy Director, Madame Chen Bing from the Municipal Health Commission, Gong Weihe, the Executive Deputy Head of the Tianhe District, and Madame Mai, the Deputy Head of the Panyu District, and Mr. Qi Yaoming, the Board Secretary from the Guangzhou Baiyun Airport Holdings, and Wang Zhanxing from the Guangzhou Railway Group, and also an expert from the Guangzhou CDC to attend the press conference. First, I would like to give the floor to the spokesperson of the Municipal Health Commission, Madame Chen Bing, to brief us the latest situation in Guangzhou. Friends from the media, good afternoon. Now I would like to give you an update of the epidemic situation in Guangzhou. First, I would like to give you an update on the new cases. On May the 31st, from 0 o'clock to 24 o'clock, we have 10 new cases. Also, one turned from the asymptomatic cases to confirmed cases. Also, we added 2 new asymptomatic cases. As of 31st of May, 24 o'clock, the total confirmed cases, 31 cases, and 8 symptomatic cases. For the 12 new cases, they're actually coming from the mid-risk Liwan district. We also screen out like 3 confirmed cases from our large-scale screening. For all of these cases, they have been sent to number 8 hospital for treatment. And for the close contacts and the secondary close contacts, we have also managed this group of population. For the new cases, we have 2 new features of the distribution. And first, we could see these cases are actually centralized in designated places. And yesterday, for the 12 new confirmed cases are in 2 high-risk regions, 2 in Zhongnan Street, 10 in Baihedong Street. And second, we could see some of these cases are coming from the same family. Among the 12 new cases, 10 are actually coming from 5 families. For these features, it actually gives a reminder of our local residents in order to reduce the risk of the transmission. For the sake of your family members and for the sake of the safety of yourself, please do not go outside. Second, I would like to give you an update on the result of the second round of the large-scale NAT. Start from May the 30th, Guangzhou kicks off the second round of large-scale NAT. We extend the scope. We also cover Liwan District, Yuexiu District, Baiyun District, Tianhe District. As of today, June the 1st, for our NAT efforts, we have tested 3.47 million samples. And in the second round of testing, we're testing over 1.5 million samples. And we have already found 12 positive cases. I would also like to give you an update on some of our strategies. Once we found some of the positive cases, and we will send these people to isolation, and at the same time, we will work on the epidemiological investigation. Also, we will do the disinfection to certain public facilities. So by no time, we will transfer those positive cases to number 8 hospital for further treatment and isolation. And also, we will check their travel history and also to find out the close contacts of those confirmed cases. 2 key areas and the key facilities, we will step up efforts for the large-scale screening and manage this group of high-risk. So by doing that, we can early identify those confirmed cases, and we can treat those patients as soon as possible. For most of these confirmed cases, they're actually identified from our close contact screening. And also, we will send these people to the number 8 hospital for further treatment. And also, we will do an expert consultation to provide treatment services to these confirmed cases. Third, I would like to give you an update on our efforts in managing travelers who will leave Guangdong Province. So Guangzhou will shoulder the responsibility to make sure that the virus will not be transported out from Guangdong Province. And earlier, the leading group had published a notification. And for the vehicles and people who are going to leave Guangdong, we will control this group of people and vehicles. And yesterday, we have sent out 62 medics. They will work on 6 districts, key transportation hub. We have set up 10 NAT testing sites. They will provide the testing to the truck drivers. We will do what we can to make sure that the transportation remain unimpeded. At the same time, in order to prevent the virus transported out of Guangdong Province, we will also raise the level of risk to certain regions. And of course, we will step up efforts in the NAT testing. We will race with the virus. We want to do what we can to cut the transmission chain of the virus. In the end, I hope we can gain the understanding of the local residents. Please cooperate with the local communities and the streets and participate in the NAT testing. Thank you very much. And just now, the spokesperson from the Municipal Health Commission gave us an update for the epidemic situation in Guangzhou. As she said, yesterday, new confirmed cases is 10, and there are 2 features. For example, we have these confirmed cases centralized in certain regions, and also we do see some of the family outbreak. So that's why she just gave us some of the reminder of the local residents. So we want to reduce the risk of the transmission of the virus. For the sake of yourself and your family members, please do not go outside. And also, I believe all of you are also focusing on the epidemic situation in certain districts. So today, we have invited 2 officials from the 2 districts. First of all, I would like to give the floor to Mr. Gong Weihe. He is the deputy head of the Tianhe District, and he will give us some of the updates of Tianhe District. So for Tianhe District, we have been focusing on the large-scale screening and also the large-scale NAT. We are working on the prevention and control measures by region and level of risk. We started our work of the targeted NAT and epidemiological investigation. We have 58 professional teams. We are focusing on 3 mechanisms to step up our efforts for the NAT, making sure that everyone is tested. As of now, through our screening, we found 36 close contacts and 333 secondary close contacts of the confirmed cases. We are following the regulation of the leading group of epidemic prevention and control. We are very proactive in the testing so that we can mitigate the risk in the local communities. We are trying our best to do the work of the large-scale NAT. We identify certain key regions and key population, making sure that we are taking the targeted measures in the large-scale testing. We focus on the 36 close contacts and also the 333 secondary close contacts. And also we are focusing on 5,945 students, and over 10,000 sanitary workers, and also 10,000 taxi drivers, making sure that all these people receive the NAT. And in Tianhe District, we are also focusing on several key regions and 8 streets. We are rolling out the large-scale screening to all of those permanent residents and the travelers who have coming out from other cities to Guangzhou. So right now we have completed testing to over 814,000 people, and the results show negative for all of those people. We are focusing on the temporary medical center, and also we are setting up a lot of NAT sample collection sites to bring conveniences to the permanent residents. So as I mentioned, in those 8 districts, those key areas, these people can receive the NAT for free. And also, we have considered all the other comprehensive factors, because right now Guangzhou is experiencing a raining season. We have mobilized all the available medical resources, so each day we have over 2,000 medics who are working on the sample collection site to collect samples. And also we are setting up over 100 temporary sampling sites. So altogether we have over 200 sampling sites for the local residents to receive NAT. Hopefully all of this work can be conducted in an efficient manner. We are also using online and offline measures to guide our residents to receive the NAT by different time slots and also by different groups. We also follow the party guidance, also give full play to the CPC members. We also have the local CPC officials to go to the sampling site to maintain the order of the sampling procedures. And throughout all the process, we are focusing on our people. We are considering the adverse weather condition. For the sampling site, 60% were installed in the open space. And also we are providing daily necessities to those sampling sites. We also open up the green channels. Also, we have an outreach team to collect the samples for those people who are not able to go outside. Going next, we will continue to prioritize our work in the prevention and control, making sure that the testing work can be completed as soon as possible. By doing all of that, we are determined to win the battle against COVID-19. Thank you. Thank you very much for Mr. Gong Weihe's briefing. And actually, the press conference is actually organized in Tianhe District. So I think it is very important to conduct good work of the prevention and control in Tianhe District. And from the information from Mr. Gong, we can see Tianhe District focusing on different groups of people and the different level of risk of different regions. They have attached great importance to the close contacts, secondary close contacts, and also they prioritize certain groups, for example, the students and the taxi drivers, truck drivers, bus drivers, and sanitary workers. And right now in 8 streets, they also provided the large-scale screening. As of this afternoon, altogether they have collected samples of 840,000 people. And right now, for all the results shows negative. Of course, in the future, we will closely follow up on the results of the NAT. And right now, I would like to give the floor to Madam Mai to give us updates on the epidemic in Panyu District. Friends from the media, good afternoon. Thank you very much for your long-term attention to the epidemic situation in Panyu District. Since the outbreak in Guangzhou City, the Panyu District have taken effective measures to contain the spread of the virus so that we can safeguard the health of our people. We have done 3 areas of work. So after we hear the first case reported from Liwan, and we have taken rapid measures. We have done a lot of work in large-scale screening, and we also have a routine screening. And we found in Jingshu Bandao District, we found 1 positive case. After we get to understand the travel history of this case, in small hours of May the 29th, after we hear the first positive case, we set up a commanding group to take effective measures to manage the group of the close contact and the secondary close contacts. We have a data analysis task force, and also we have a epidemiological task force. Also, we have a community task force. We are able to identify 57 close contacts and also over 140 secondary close contacts. And for certain buildings, we are doing the disinfection immediately, and also we are able to impose lockdown to certain districts. For Nanpu Island, we are also imposing traffic limitation. And we suspend the operation of the subway station for the Nanpudao station. Within 5 hours after the identification of the 1 case in Panyu District, immediately we take these effective measures to contain the spread. And soon we will roll out the large-scale NAT screening to Panyu District, especially for people who are visiting the Nanpudao station. With less than 2 days, we have completed the NAT for people who are living in this area. So right now we have received the result of 165,000 people, and the results show negative. And on 30th of May, we extend the scope of the testing. We are forming a medical team comprising with 1,000 medics, and these people will stay in Luohu and the Shibi Street. Once again, they will do the NAT testing. They are stationed in 2 villages and 1 ecological park. And they will roll out the nucleic acid testing for the permanent residents who are living nearby this region. So altogether, the samples we have collected over 450,000 people, and right now we have received the results of over 300,000 people, and all the results show negative. And also, we are providing a lot of services to people who are living in the Nanpudao. In the past few days, we are imposing lockdown to that region. So we have to ensure that the daily needs can be met. So we have allocated over 8 transportation vehicles, and we have sent meat and vegetables over 100 tons to the region so that the people's basic needs can be met and they can enjoy their daily life. And also we have CPC officials, they are participating in this task force. And for people who are quarantined at home, they can actually send out their request through WeChat and mobile phone. And for our our volunteers and also our workers, they can collect all of those requests and also send out the daily necessities to those people who are staying at home. By doing all of that, it actually widely appraised by the permanent residents. And also we have a screening team. They're visiting the primary school and kindergarten. With 4 hours of work, we could see all of these medics, they're sweating out. And for the students and the teachers, they're actually paying tribute to the medics. They're singing songs to show their gratitude to the medics. And for the medical workers, they're deeply touched by what they have done. And also, they're greeting these children. And actually, we could see some of these videos are circulating in the internet. This shows that the general public, they respect our medics who are actually working at the front line. And also, this video is very encouraging. It actually encourages the medics to do much better to safeguard the life and the safety of the general public. So thank you very much for Madame Mai's briefing. I believe all of you attach great importance to the epidemic situation in Panyu District. And just as Madame Mai tell us, and for Panyu District, they already isolate all these close contacts and the secondary close contacts. And also they're quite fast in the response for the large-scale screening and the NAT. As she just briefed us, among the 165,000 people who have been collected with their samples, and right now the results show negative. And also, among all the nearby permanent residents, Panyu District has collected 450,000 samples, and over 90% of them are show negative. And also for Panyu District, they have done a lot of work to provide daily necessities and daily services to the local residents. And for people from the public, they are also showing their gratitude to the medical workers. So thank you very much for Madame Mai Jiping's briefing. And in the past few days, actually, the municipal government have published a lot of notifications. For example, for people who want to leave Guangdong Province, they have to provide certain certificates. And I believe the media also attach great importance to this issue. And today we're able to have the board secretary from the Baiyun International Airport holding group to attend the press conference. And this time, as the notification has been published, I would like to understand what steps will be taken by the Baiyun International Airport Group. So first of all, thank you very much for your briefing. And right now, I would like to give you an update on some of the measures will be taken by the Baiyun International Airport. First, we will check the green code and health code for all the passengers who are about to leave Guangdong Province. According to the instruction and notification published by the leading group of epidemic prevention and control of Guangdong Province, for Baiyun International Airport, for people who will leave Guangdong Province, we will check their NAT reports and certificates in the past 72 hours. In the two terminals, we have set up a special station to check their NAT reports. In the security check channel, we will check the green code and also the NAT test results for all of those passengers. And also, at the boarding gate, we also have a second layer of checking. So actually, before these passengers enter into the boarding gates, we are able to check all of the health conditions of these passengers. So for these two criteria, are all eligible for our check. For example, if some people fail to show a green code, So we will facilitate these passengers to change their tickets or to refund their tickets. In the departure hall, so every 2 hours, we will have the broadcasting to remind all the passengers to prepare certain certificates and reports. And we also educate the passengers the latest notification and the regulation from Guangdong Province. We also work with the airlines so that these airlines will send out the notification to the passengers. So for example, these passengers, they have to show a green health code or they have to show the NAT certificate. So since the rollout of the new notification, we have maintained a good order.
5月31号22点到6月1号中午12点，白云机场共保障航班129班，实际出港旅客5908人，其中有359人未能成行。这些旅客都得到了免费退改签服务的保障。白云机场将继续做好各项疫情防控工作，保障旅客安心抵离。
They can get a free refund.
白云机场在对于国内、国际不同的疫情防范重点航班分类、科学、精准采取，
the safety of all the passengers.
在国内方面，从
For the
国内
Bayun
中
International
高风险
Airport,
区来穗的航班，
we will also take
白云机场采
precise
取
and
4
targeted
步
measures
保障措
for
施
the
落实航班
domestic
保障。
airlines and also the
一是
international
固定
airlines.
机位
So
廊
for
桥，
airlines arriving
二
in
是固定保障车
Guangzhou
辆，
Bayun Airport from the mid-risk regions,
四是固定
so
工
we
作流
will
程。
also
在
take
工作
effective
流程是
measures.
排查、
For
隔
example,
离、
we
转
will
诊、防护和消杀。
dispatch a designated
从国内其他
vehicle
城市
and we will
飞来
check
广
the
州，白云
temperature
机
for
场会
all
在
the
抵达航班
passengers
出口处为旅客测量体温、查验健康码。体温正常，
So for
健康码为
airlines
绿
that
码
has
状
been
态，
arriving in Guangzhou from other cities
在
other
国际航
than
班
the mid-risk
疫情
regions,
防控方面，
the airport
我
will
们每
check
天
their health code
下午
and
5
also
点
their temperature.
前收集
If their
汇总
temperature is
第
normal
二
and
天
also they are able
国际
to
入境航
present
班的计划，通
the
报
green code,
1+9
we're
指
able
挥
to
部
let them go.
及各保
And
障
for
单位
international airlines,
对入境航班实施全
so
流
at
程
around
全
like
范
5
围的
p.m.
管控，
every day,
严格落实事前干预、事
we
中
will
处
collect the
置、事后
information
优
on
化
all
的
the
闭环管理
incoming
的要求。
airlines. We will
采
have
取
an all-rounded
四固定的保障措
regulation
施，
for all of
通过
those
设置
airlines.
临时集
So
中点、
making
中
sure
转
that all of these
等待
airlines can
区、
be checked
临
and
时
also
检疫采
the
样区、
personnel can be managed.
专区，保障国际入境旅客
We will set
从
up
下机到
temporary
转运全过程
transfer
均在
center
专
and also
用
we
区
will
域
set up the
完
temporary
成保障，
sampling site
全流
to
程封闭
make
管
sure
理。
that
白云机
after
场
all
还
these
设置了
passengers
出入境机组专用保
leave
障
the
通道，
airplane, we are
避
able
免机
to
组
monitor
与旅
their
客
health
交
condition.
叉接触，
So this is a
确保
closed
机
loop
组和旅客
management.
的安全。接下
And
来，
also we
白
have
云
a
机场将
designated
继续与口岸单位、省市
channel for the
部
crew
门、
members
航空公司
to
做到
ensure the
信息
safety
共
of the
享，
crew
加强
members
联
and
动，
the
守好
passengers.
通门户，
Going
严
next,
防
we will
境外
work
疫情的
with
输入。
other
同时，
border
联合航空公
stations
司
and
严
border
格落
checks
实离穗旅
or
客
work
健
together
康码
with
绿码
other
和
cities
72小时核酸检测阴性证明
to make
查
sure
验检
that
测，
there's no imported
全力营造
infection.
安全、高
And
效、
at the
顺
same
畅的
time, we
出
will
行环
check
境。谢谢
the
大家。
NAT certificate and the green code for all
好，
those
感谢咱
people
们广
who
州
are
白
about
云
to
国际机
leave
场
Guangdong
传译室
Province,
谢耀敏
making
先
sure
生，
that we
也
can
是
bring
我们白云机
conveniences
场的
to
新发
all
言
of
人
these
这个
people.
通报。
Thank you very much.
白云空港可以说是我们国际重要的航空枢纽，每一局
Thank you for Mr. Qi's briefing.
特别是我们出台了公告以后，对于离穗的旅客，我们72
For
小时
Panyu
检测。刚才肖明先生
Airport,
做了一
we
个
could
很清
see
楚的
it is a
通报。我们从
transportation
昨天
hub,
晚上
especially
22
in
时到
China
今
and
天
also
中
in
午
the
12
world.
点钟，我们从白云国际
And
机
for
场的
people
这
who are
个
about to leave
航班
Guangdong, making
129 班
sure that
次
you
实
can
际出航
provide a NAT
908 人
certificate
参与
valid
那么
for
一
the
共
last
是
72
359
hours,
位
and
这
you
个
are
乘客
able
呢
to
是
present
未能
a
提供
green
相关的符合
household.
标准的我们核酸检测证明和绿码，那么未能成
So
行。但是我刚才在
actually,
这
in
个
the past
提
few
醒我们
days,
和系统都沟通的时候，
around
所有的
7,000
这些
people
未
leave
能出行
Guangdong
的游客
Province.
是
However,
非常的理解，
over
非常理性。
300
我
people
们
they are
公告
not
呢也通
able
过我
to
们各
show
个
the
媒体
green
和
code
代理
or they're not
广
able
告知
to
了。我们也希
provide
望大家
the
接下来这个过程之中呢，
negative
更好的
NAT
能够
certificate.
使更多的人能够知晓。当然，我们
But these
航空方
passengers, they
机
are
场方
showing
和
a
航
high
空公司
level
做
of
得很好的，我们
understanding,
为
and
所有
we
的未
will
能如
provide
期
them
出行的旅客
the
都办理
refund
了
free
免
of
费的
charge.
退改签服务，因为我们每个游客的这个旅行计划都
And
非
of
常严
course,
谨，我们希望大家
for
更多的
the
能够提
Panyu
前把
Airport
相
and
关的
also
这
the
个工作能够做好，
airlines, they
确
are
保每
also
一次出行
providing a
的
lot
安
of
全顺畅。
services to
非
these
常感谢白云
passengers.
国际
So
机
at
场
this
肖
special
明先生
time,
的
so we
发布。
have to
接
be
下来
very
呢，我
cautious. So making sure that if
今
you
天
are
我很
going
高
to
兴地
leave
邀请了
Guangdong
广州
Province,
南
make
站
sure
的
you
我们
prepare
陆路交
the
通管理
relevant
副书记王展
certificates
先生
and
通报
the
一下广
reports.
州南站的我们相关疫情防控的情况。有请王书记。
And today we are also
各位媒
glad
体
to
朋
be
友，
joined
大家下午
by
好。
this
根据
Deputy
广州市
Secretary
新型冠
for
状
the
病毒肺
Guangzhou
炎疫
South
情防控指
Station.
挥部的部署
So
要求，
he will give us an
那么自
update on the situation, the epidemic
2021年的
situation
5月
for the
31日，
Guangzhou
也就是昨天晚
South
上
Station.
22点开始，旅
So
客在
according
广州
to
地
the
区过火
regulation
车
of
站，
the
包
Municipal
括
Leading
广州
Group
南
on
站、
Epidemic
广州站、
Prevention and
广州
Control,
东站、广州北站、新
start
塘南
from
站、石牌站、
yesterday
青盛站，就进站乘
from
车的时候
10
需要
p.m.
出示健康码、绿码，
for passengers
和
who
72小时内
will
核酸
visit
检测阴性
the
证明，
railway
而且要
stations
保证体
in
温，
Guangdong
不高于
Province. If they are
37
able to
3摄氏
board
度。
the train, they have
那么为了
to
进一步做好疫情防控的
provide the
相
green
关工
code
作，
as
给
well
各车
as
站
the
采取了
NAT
相应的这个
certificate.
防疫
And
措
of
施。
course, their
比
body
如在
temperature
广州南
should
站
be lower
就采
than
取了
the
以下各方面的一
37.3
些
Celsius
措施。
degree.
第一个是在实
So
名
for
验证
different
区，我们
stations,
设
they're
置
also
了
taking a
4个
series
健
of
康
the
码
epidemic
和核
and
酸检
prevention
测
and
证明的
control
查验点，
measures. For example, for
对
Guangzhou
所有
South
进
Station,
站
they
旅客
have taken
进健康码
5 areas
和
of
核酸
work.
证以及
So
测体
for
温，
example, we have the check-in
并在
points,
各个查验
to
点配备
check
了这个
all
防
the
疫的应
passengers'
急物资箱，确保
green
应急无
code
备。
as well as their
第二个呢，
NAT
我们是
certificate.
严格
They
落实
will
站
also
内消
check
毒、
the body
通风的
temperature
措
of
施
the
要求，
passengers who are
强化
in
对
the
电
Guangzhou
梯、
South.
验证及进出
And
站
at the
闸
same
机、
time,
厕
we
所
are trying our
等
best
客服设备
to
设施消毒
provide
的
the
频次为密
services
度。
to these
每日
passengers.
营业
And the
结束以
second,
后，
we are
我
doing
们
a lot
对
of work in the
整个车站战场
disinfection
进行全面的消毒。
and the ventilation, especially the
在进出站通
disinfection
道、
in the
检票口、
toilets,
站台
the
等区域
elevators, etc.
张贴相
So
关的提示
after
告示，
the
安排专
train
人进行
station
引导，并且加
CC
大
operation,
广
we
播
will
的
do
宣传
an
力度，
overall
确
disinfection
保旅客有序
to
进站。
every corner
防
of
止聚
the
集。
South Station.
第四
And
个是
also
我们
we
在
posted
车
a
站的
lot
公共
of
区域
notification
摆
in
放
the
了
Guangzhou
37
South
台
Station.
免费的口
And
罩机，
also we are doing a lot of
在
broadcasting
各进
to
出站的这个口
send
站，
out the
我们
alarm
也摆放
to
了免
the
费的
passengers to avoid the gathering.
免洗消毒液。
And
供有
also
需要
in
的
the
旅客
Guangzhou
使用。
South Station, we are
后来我
setting
们也
up
还是加强我们自己
37
工作人员的
face mask
一些这个个
vending
人的防护，
machines. And
要求我们
also
当班的工作
we
人
are
员
providing
要严格按照岗位
the
需要佩戴个人
disinfectants
防护
to
的这
the
个用具。
passengers.
同时呢，我
And
们
of
还
course, we
认真执行
educate
上下班这个
our
测体温
workers
的
to raise
措施
the
要求。
awareness.
以上呢就是我们
For example,
管理
we
集
will
团的
ask our
一些
workers to wear the
基本
face
情况。
mask,
谢谢。
and also they
好，
have
非常
to
感谢
check their
广
body
州南
temperature
站党委
before
副书记
they are
王展
going
新
on
先
work.
生把我们
So
通
this
告
is
时
what we
间
have
来
done
我
for
们
the
广州
epidemic
地
prevention
区
and
各个
control in
火车站
Guangzhou
具体
South
来讲就是
Railway
广州南、
Group.
广州站、
So
广州东
Thank you very much for Mr. Wang Zhanxing's briefing on the work have been done by the Guangzhou South. So actually, he has briefed us on some of the requirements and the epidemic prevention and control measures taken in several railway stations in Guangzhou City. So we could see for all of these workers, they're focusing on a people-centered strategy and provide services to the passengers. And especially, once again, I would like to remind all the passengers who are about to leave Guangdong Province, please prepare the documentation in advance.
获得提问机会的各个媒体朋友，首先通告一下自己所供职的媒
And
体机构
next,
的名称。
I would
好，
like
时间留给大
to
家，请
give
举
the
手。
time
好，第一
to
排第一位，这
the
边
friends of the press.
您好，我是新华社记者。我想问一下，
So
就是 广州
before
连
you
续高
raise
新
the
增病例
questions,
您
please
更担心
announce
针
where
对
you're
病
from.
毒的这些新特点，现有的防控
With
措
Xinhua News
施是不是
Agency,
足够？是否要扩大防控范围和
for
强度？
Guangzhou
谢谢。
City, for several days,
好，感谢新
we
华
do
社记
see
者。我
some
们
of the
请
new
陈斌副
confirmed
主任回应一下
cases.
这个问题。
I would like to understand, is it necessary for us to
谢谢您
extend
的提问。
the scope of the
近日
screening or
连续出
NAT,
现的这个
given the
所谓的这个
situation
阳
is
性
quite
病例
severe
呢，
in Guangzhou
一方
City?
面跟我
I would
们
like
昨
to
天发布会上
invite
我们
Madam
提
Chen
到
Bing
过
to
的
address your
造成
question.
这次传播的
Thank you
新
very
冠
much
病
for
毒
your
这
question.
个
And
印度
recently,
发
we
现
do
的
see
变异
some
株
positive
有着
confirmed
潜伏期
cases.
短、传播
And
速度快，
yesterday,
还有病毒载量高，
actually
这
we
三大特点有着
briefed
密切的
the
关系。
media that
那么另一
we
方
could
面呢，这
see
也是我们启动更
the
快、
variants
更
found
强
in
的
India
防
have
控手
some
段的一个
have
实际
three
的效果。
features. For
那
example,
通
it
过
has
加
a
快
very
流
short
调，
incubation
加大
period,
核酸排
and
查
also
的
we
力
have
度，
very
不
fast
仅能够
spread
提高
of
密
the
接的这个
virus,
管控速
and also
度，
this time
也能够
the virus
这
have
个
a very
加快
high
这个高
viral
风险
load.
区域的一个排
And
查
this
的
time
效
we
率。
step up our
更
efforts
重要
in
的
the
是呢，能够
mass
使得更
testing, and
多的
also we
潜
step
在
up
的
our
感染
efforts
者在
in
更
the
短的时
virus
间，
tracing.
甚至就在没有发病
So
前
the,
能够
all of
被
these
诊
can
断
help
出
us
来。
to improve
那
the
这给我们
efficiency
阻
of the
断这个
screening
病
in
毒的
high-risk
传播
regions.
或是疫
By
情
doing
的
all of
向
those
外
work,
扩散，是
we
抢占
can
了宝贵
we
的
are
时间。
able to
那么
find
大
out
家
those
关注近期公
asymptomatic
布的这个
cases.
通告会发现，目
This
前
will also
报
help
告
us
的这
to
个阳
contain
性
the
病例
spread
中
of the
有
virus, and
18 例
also
都
it
是
will
从
help us
无
to
症
save
状
some
感染
time
者
to
转为确
treat
诊病例
these
的。
patients.
这就是我们甄别排查工作这个
And
成效
right
的
now
一个
you
很
could
重要的
see
体现。
for
所以
all
呢，
the
近期
confirmed
会持续
cases,
增新增不少
18
的病
cases
例。
actually
那么
turned
目
from
前
the
我们报告
asymptomatic
的病
cases
例
to
呢是
confirmed
高度
cases.
集中在
This also
密
shows that
接、次
our
密接
work
人群以
is
及
working.
闭湾区的这
And in
个
the future,
大
maybe
排
you
查
may
中的
see
重
an
点
increase of
区
the
域。
confirmed cases.
这也是
Right
反映了
now,
我
for
们
the
以闭湾
confirmed
区、中南
cases,
街、百合
most
洞
of
街
these
等为
cases are
核
actually
心圈，
centralized in certain
病例
districts.
设
For
计的话，
example,
活
in
动场所为
some
这
of
个
the
警戒
districts
圈，
in Liwan
其他
district. So,
外
for
围管
example,
控
we
圈
have
的
to
一个
focusing
防
on
控
the
思路
Zhongnan district
是
and the
正确的。
Baihodong
在流调
district,
和密
and
接
all of
甄别
those
上
nearby
加速，
facilities
在核
need
酸
to
排
be
查上加量，在人员管
tested.
控和场
And
所
we have
限流
to
上加码
focusing
这
on
个
the
防控
virus
抢在
tracing
所
in
一
those
解，
areas.
扩大排
And of
查
course,
好
we
在
have to
先这么一
extend
个防
our
控策略呢是
scope
有效
for
的。
the large-scale
那
NAT,
么接下来呢，我们也会
meaning
一
that we
直
need to be
这
more
个动态分
proactive
析
in
和
the
比
prevention
对
and
阳
control.
性病例
And
的
also
区
we
域
have
分
to
布
extend the scope
和
of the
现阶
testing and
段
the
我们
screening.
3个防控圈的这个范围，结合
And in
流
the
行病
future,
学
we will
调查的
continue
病
to
例间
do
的
the
关
dynamic
系，研判
analysis
疫情的这个发展的
to
趋
better
势。
understand the
适当的时候会
epidemiological
调整这个
investigation
防控
for
的
those
区域。
confirmed
好，我
cases,
就回答到这儿，谢谢你。
so
好，
that
感
we can
谢
better
新华社
seize
记
the
者提问，
trend
感
of
谢
the
广州
change
卫
of
健
the
委宣发
epidemic.
人
When
陈斌副主任的
necessary,
回应。
we will
好，时间
adjust
继续
the
留给
certain
媒体朋友。
measures.
好，左前方第4排这位
Thank
女
you
同胞。
for your question,
谢谢主持
and
人。
also
你好，我是
thank you
南都记者
for
这个问题想
Madam
问一下
Chen
天河
Bing's
区的工区，想问一
briefing.
下天河
All
区
right,
现
next
在重
question.
点区大规模核酸检测情况如何？谢谢。
My question is
好，
to
非常感
the
谢我们南都的这位
Deputy Head of Tianhe District, and right now we are rolling out the district-wide
在
NAT in
5月
Tianhe District. Can you
30
tell us more about this?
我们区启动了8条街道
Thank you very
大
much
规
for
模
your
的核
question.
酸检测。那么做好这个核酸检测，
On May the
特别
30th,
是组织好我们
for
的市民
Tianhe
有
District,
序参与
we rolled out the
同时呢，在组织
large-scale
的过程
NAT
之中
for
落实好
8 streets.
防控的措施，特别是做好这个服务
So we
这
have
方
to
面对我们
maintain the
做好核酸
order
工作呢
of the
是
sample collection,
十分重要的一个环节。
and of course,
那
we
么
we have
截
to
止到
strictly
今天的
implement
实
the
施时
epidemic
的时候
prevention and control,
我们
and
8
we
条
need
街
to
道的
provide
已经
services
累计
to
完成了
people who are
81.4 万
attending the
人的
NAT.
这个采样，
As of 2
已
p.m.
经检测的
today,
结果的均为
for
阴
all
性
the。A
那么
streets,
做好这项工作呢，
we
我
have
们
completed the sample
几
collection
个方
for
面
840,000
做好
people,
这个大规模核
and
酸
all the
检测的
results
工作
show
一
negative.
个方面呢，是我们做好这个科学布
We have done a lot of
检测
work
点。那么
for
我
the
们
large scale
这个
NAT.
点的选择，我们
First
是从固定点跟临时点相结合。我们原先有108个
We have made a
核酸的
scientific
固定的检
arrangement
测点。那么根据我们
for
这
the
次大
testing
规模
site.
的
We have a fixed testing site and also we have temporary testing sites. For example, we have 108, a fixed testing site. However, according to the requirement of the large-scale NAT, we have to consider the factors of the transportation, the population, and also the change of the weather. We have made some analysis, and we are able to setting up 174 temporary testing sites. We will mobilize all available resources to provide conveniences for the NAT sample collection. Second, we are able to work with the hospitals, the local hospitals. For example, we work with the Zhongshan Hospital, Wujing Hospital, and several other A-level hospitals in Tianhe District to roll out the NAT testing. So altogether, we have 1,600 medics to provide the NAT services to the local residents. That's why I say this time the NAT is quite effective. Third, we have to do a good work in organizing the local residents to receive the NAT. We have some district officials to stay on site to maintain the order of the NAT. And also we have local CPC members stay on site to provide guidance to the local residents. We fully consider the needs of our residents. We are providing a lot of humanitarian services to the local residents, especially for the design of the sampling site. We are providing sufficient drinking water to the medics as well as the permanent residents who are about to receive the NAT. And also we attend to the vulnerable group. We also open up green channels to provide services to the disabled people. So all in all, this sample collection work is highly praised by the local residents. Thank you. Thank you for your question. So actually, as Mr. Gong said, for the epidemic prevention and control work, especially for the large-scale NAT, so they have done a lot of work to provide services to the permanent residents. So actually these days in Guangzhou, you could see the weather is not very good. We all have these heavy rains. And hopefully in the future, for different districts, they can do effective work to ensure the successful operation of the large-scale screening. Next question, please. So my question is to Madam Mai from Panyu District. I also want to understand the current situation of the NAT in Panyu District. So for Panyu District, as I said, we have 2 districts. We roll out the district-wide NAT. And also in 2 towns, we will do the nucleic acid testing to partial group of the population, including the ecological park, the Meishan village, and Haibang village. So altogether, we will roll out this nucleic acid testing to 5 towns, 2 villages. We mobilize the medical resources from different hospitals in Panyu District. So for these medical workers, they were stationed in these 5 towns and 2 villages. So right now we have collected samples for over 450,000 people. And right now we have received the results of over 300,000 people. And all these results show negative. And during the NAT procedures, we have set up the sampling site in different places to avoid gathering of the local residents. And also the sample collection will be conducted by different time slots. For the local communities,
第三个呢是做好这个
they will organize the villages by different groups in different slots
每一个
to
镇街都
receive
有一个
the
区领导
NAT.
去督导，每一个检测点
Third,
都有一个
we
处
also
级的
delegate
去挂
some
点，
local
然后每一个
officials to stay on
这个筛
site
查
to
点
provide
都
guidance
有
on
安
the
保方案，
NAT.
确保呢
For
现场
each
是
one
能够
of the sampling
是
sites, we
确
will
保
have a
这
local
个核
official.
酸筛查的点不会
And
成
also
为
we have
病毒
the
传染
security group
我就通报到
to
这里。
maintain the order of the NAT.
媒体朋友的提问也感谢我们潘
Of
玉
course,
区
we will make
麦姐
sure
给
that
付
there's
出上的
no
回应。
cross-infection
好，继续
occurred
我
in
们
the
把
sample
时间
collection
留给媒
site.
体朋友。好，第4排中间这位女同胞，好。
Thank you very much for your question.
各位好，我
Next
是广州台的
question.
记者。那么问题是想问市疾控中心的张主任。那么从昨天开始是暂缓接种疫苗，那么对那些需要打第二针的市民
With
来讲，会
Guangzhou
有
TV
哪些
station,
影响？以及您
my
对市民
question
接种疫苗会有
is
什
to
么样
Mr.
的
Zhang
意见？
from the Guangzhou CDC. And yesterday, you have made an announcement that we have to suspend the vaccination program in Guangzhou. Will they have some influences for people who need to receive the second dose of the vaccine? Thank you very much for your question. Yesterday, we said we suspend personal appointments for vaccination. Actually, we have considered a lot of factors. We need to avoid gathering to avoid the risk of
扑灭这次前所
cross-infection.
未有的疫情是我们当前最重要的一个事情。防控主动提及，实施防控抢在锁定前，
So
扩大
first,
排查
we
好
could
在
see
先
there's
的
an
防控策略，
outbreak of
要开展核酸
the
大排查，
epidemic in Guangzhou.
密接
So
次密
we
的
have
甄别
to
追踪
contain the spread of the virus
都
right
需要
now.
大量的医务人员参加，才能够确保
So we have to follow the
防控
general
措施
guideline, that
再
is
加速
to be
再加码
proactive in the
再加量。
prevention and control and
而大
extend
规
the
模
scope
的
of the
人
testing and
群新
screening.
冠疫苗接
So
种
right now, you
也
all
是
know
需
we
要
are rolling out the
大量
large-scale
的医务人
NAT.
员参
It
加，
also means that we need more
才能够
medical
保证我们的这种
workers
接种安全。
to
说
participate
实
in
在
the
的，两线
NAT.
作战很不容易。
And of
所以
course, you
说，
know,
为
if
了
we
避免
push
两线作
along
战，
with
我
the
们要集中
vaccination
优势兵力，
program,
投入到
meaning
这
that
种
we
防控
still
战中，
need to
确
a
保
large
在最
group
短的
of
时间内
medical
能够
workers.
扑灭疫情。然后再调整
But
资
right
源，
now,
把我们的这个
the
医务
priority
人员
is to
呢，
contain the spread
再
of the
转
virus.
换到我们新冠疫苗
Because
的
right
这
now
种
we do
大规模
want
人群
to
接种当中。
contain.
那么第二
the
个方面
epidemic.
呢，主要是在目前的这
So
种
we will have
防控形势下呢，
these
减少人
medical
员的聚
workers
集，
to
也
focus
是
on the
我们
large
对于
scale
疫情防控的一个
NAT.
非常重要的手段。那么在前几次
And
的
after the situation is
新发布会上，
improving, then we will
我也
have
反
more
复强
medical
调，那么
resources
在这个时
to
间
do
时
the
期内，
vaccination.
我们还是要做到
And
少
second,
聚集、
as I said,
不聚集。那么
at this time, we have to
因为疫
avoid
情的原因
gathering
呢，
as
实
much
际
as
上大家也都
possible.
看到了，前一段时间呢，
So in this time, we have
市
to
民的
avoid
这个
gathering or
新冠疫
no
苗接
gathering
种意愿是非常的高涨。
because of the
那么很
epidemic.
多人没有预约到，也跑到现场排大队，就是
You could
希望
see in
能够
Guangzhou City, the
当天就
Guangzhou
能够接种
residents
到
have
其
a
实造成了一定程
stronger
度上的
will
聚集。
to
那么在个
receive
别的接种
the
点，
vaccine, even though
聚
they're
集
not
的
able
这
to
个
make
情
the
况非常
appointment,
的
but
严重。
they want to
那么为
get
了
injected.
为了避免
And
在
this
这
will
种
cause
高度
gathering,
人群聚集的情
especially
况
when I
下，
see
这个造成一
different
些不必要的一
vaccination
些
sites. We
可
do
能
see
存
a
在的感
huge
染的风
group
险。
of
所以说
gathering.
我们也是需要进行一个调整。
But right
第
now,
三
we
呢，
do
就是
want to lower the risks
接种疫
of
苗
cross-infection.
到产生抗体，到你能够
So we
产
need to
生
make
针
some
对于
adjustments
我们
in the
这个疾
vaccination
病的
programs.
免疫力是需要
And
一定时
third,
间的，不是说我今天接种了疫苗，
after you
明
get
天就
vaccinated,
有保护力，
it takes some time
不
for
是这
you
样
to
的。
generate
一个
the
今天打明天就有的
antibodies
这样一个
and to build up
情况，
the
它是需要一定
immunity.
时间那么十几
It
20
doesn't
天
mean that you
甚
get
至还有这更长一点的时
inoculated
间，
today
这个
and
是根
then
据我们每个
tomorrow
人的身体
you're
状况
able to
个体的
generate the
差异会
antibody.
有所不同。
It takes some
但
time,
肯定不是
say
说
10 or 20
短
days
短
or
的这一
even
两天一个
longer.
星期我们就
So
能够
this
产
is
生。
subject to
那么也就是说，
personal
近期
situation.
你着急去排队接种疫
So
苗，
it's not like within 1 week
对于你
you
自己
get injected and then you're able to
抵御这
generate
个疫情的这
antibodies.
种风险、感染的风险，实际上是没有什么帮助的。基于以上原因呢，我们
So
就
if you're getting very
暂缓了
anxious and
个人预约
you're
和社会
trying
接种，
to
但是针对
get
于
yourself in a long queue to
边
get
岗位
inoculated,
的团
and
体预约
this
和
will
集
not
体
help
预
you
约
to
实际上并
generate
没有停止。
antibody.
仍然是按照属
immediately.
地管理的原则。
So that's why we suspend the vaccination program
主管
in
部门根据
Guangzhou.
本辖区
However,
的重点行业、重点人群实际接
we
种情况
still prioritize the vaccination to key groups of
然
people.
后获得同意之后，我们实
So
行
for
一个
local
序的
communities
一
or
个集体
local
的这个
jurisdictions,
接种。
and they
这
can
也
actually
是为
file
了
the
确
request
保这
to
个
the
我们是
local
分类
health
推荐
commission
这个
after their
特殊重点
request being
需接种。
approved, and this
那
high
么对
risk
于我
group
们普通市民，可
of
能现在
population can
昨
still
天
be
新闻
able
出来
to
之后呢，
receive
很
the
多市民
vaccination.
有很多疑问其实最担心的
So
就是
for ordinary citizens,
我错过了这个
after
时
they
间
heard the news
没有接种疫
yesterday,
苗，会有什么影响？
I
那么
understand
国
there
家
may be
目
some
前的
doubts
推
or
荐的这个
questions,
新冠疫苗接种的
and some people are saying,
时间是
I missed this time slot,
第二剂次
I'm not able
在
to
3
get
周
vaccinated, so maybe there may be some impact
尽
on
快完成。
myself.
实际上呢，是希望大家在完成第一针之后，
So
最
if
短
you
21
you
天
already received
那
the
么
first
之后呢
dose,
尽快
so
能够完成2针的一个全
up
程的接
to
种，
3
是
to
为了
8
能
weeks
够
time,
尽快的对我们个人产生一个
you could
免疫
receive
力
the second dose.
但是超过8周再接种第2剂，其实是没有问题的，一样是可以让我们的基
So
因有效
after
地产生这个
completion
抗
of
体，
the
完成全程免疫。
2 doses,
国家
you are able
制定
to
的这个新冠
generate
疫
the
苗
antibody.
接种
But
规
it
范
doesn't
里面
mean
也
that
很明
after
确地
8 weeks,
写到了，就是说我们
you
因为
cannot
各种
receive
原
the
因
second
没有能
dose.
够在8周以内完成这个
So
全
if
程
we
接
look
种
at
那
the
么后续
vaccination
只要
notification
完成这个第2
published
针
by
次
the
的接种，
NHC, so for example, for some reason you are not able to
说是
receive
不
the
动什
second
么
dose
这个
of the
所产生
vaccine,
的这个效果也是一样
after
不受
8
影响。
weeks, you are still able to
那么
receive
我想呢，
the
大家
vaccination.
可能最顾虑的就是这个原因。
This will
那么
not have
这样
any
解释，我们希
negative
望能够
impact
让我们的
to the
这个有
generation
所
of
顾
the
虑的市民
antibody.
能够有一些安心。开展我们人
Hopefully
人
I
群新冠疫
can
苗接种的这个工作，
address
不仅
some
仅
of your
是
concerns.
我们市民个人的强烈愿望，实际上也是我们要尽快的建立人群的免疫屏障
For the
的一
vaccination
个
program,
需要。所以说，对于目
I
前
understand
这
our
个没有
local
办法预约
citizens, they
接
do
种的
have
市
the
民，大
strong
家也
will
不
to
要担心。
receive the
等到疫
vaccination.
情控制之
And
后呢，
also by
会
having the
尽快地恢
vaccination,
复
the
大规
whole
模人群
nation, the
的
whole
疫苗
city are
接种
able
工作
to build up the
那么我们也会
protection
梳理
network.
因为现在这
But
个疫苗
please
接
do
种
not
全是信
worry.
息化
After
接
we
种。那
contain
么针对于
the
已
spread
经
of the
完成了
virus,
第
we will
2第一
resume
剂次，还没
the
有完成第
large-scale
2剂次的，
vaccination
我们在
program
恢
in
复个
Guangzhou
人预
City.
约社会接种的时候呢，我们会优先安排
For those
第
who
2
have
那
already
个需要接
completed
种
the
第2剂
first
次的
dose
市
of the
民优先的
vaccines,
去预约和
so
完成。
later
所
on
以说
we
的话，
will
在这一阶段，
resume
我还是要
the
再次利用
appointments
这个机会
for
呢，
this group of
这个
people,
呼吁
and
一
we
下，
will
就是在这个阶段，
prioritize
我们
those
所有
who
的
have
市民
received the first
就
dose
是
to
一定
receive
要
the
保持
second
我们
dose.
个人的一个
So
良
by
好的卫
taking
生
this
习惯。
opportunity, I would like to make
之
appeal
前的
to
我
the
们
public.
再三强调的防护措
At
施，
this
我们
critical
一定是不
time,
能够放松的。我们戴口罩、勤洗手，
please mind your
保持社
own
交距离，
safety and
最
mind your
重要
own
的是
hygiene.
不要聚集，
We have
尽
repeated
量的
the prevention and
减少
control
聚餐的
measures
次数。
for many
特别
times. We
是
have to
我
wear
们在
mask, we
我
have
们
to
这个
wash
我们
our
说
hands
发了几个圈，
frequently.
在
But
核
the
心区
most
警戒区
important
之外
one
的
is
很多人可
avoid
能还是
gathering,
觉着，哎呀，这个地方
avoid
封闭
having
我还
meal
是挺安
together.
全的，我这个区也没有病例我仍然是这个这个
And also, you know, we have
这个腰棚患有
divided
的
our city
3分之
into
1小
different
区为
areas.
大区的
And for some
还是
people,
需
maybe
要
they think
把这个疫
I
情
live
防控
quite far
当
away
做自己
from
的
those
事情
high
做，
risk
减少聚集
regions.
才能
And
够
these
在
people
我
will
们大
still
家共
tend
同
to
努力下
have
尽
these
快控制
meal
住疫情
gathering with their friends. But still, I think at
好，
this
感谢
time,
广州广播电
you
台
have to
给
be
媒体朋友的
cautious.
提问啊。刚才我
You
们
have
访的
to
是疾
join
控中
hands with
心
other
的副主
local
任，也是我们
residents so
资
as
深的
to
先发
contain
言
the
人张
spread
斌
of
副
the
主任做了一
virus.
个很详实的回应。
Thank you very much
新闻发布
for
会
your
上，特别
question.
是我们宣布我们
And
暂
the
停一下
Deputy
我们
Director
的社会接种以
of
来
the
呢，大家的
Municipal
反应
Health
还是比较
Commission
积
have
极。我
gave
看
you
这
a
个
very
热搜迅速上
detailed
来了，我们
explanation.
也在接下来的这个新闻发布工作 过程之
indeed,
中，可以及时的、
and
全
yesterday,
面的、快
after
速
we
的、
announced we
更加详
suspend
实的
the
把我们相关的一
vaccination
些配套细则第
program,
一时间的做好
there are a
部
lot of
署。
heated
那昨天
discussion
晚上也非
in
常
the
感谢我
public.
们各个媒体朋友非常的关注，
And
特
of
别是
course,
昨天晚
and
上
in
新
the
闻加一
future,
啊，
we
白
will
岩松
give
先
you
生也
more
是采访了
details
专
and
门飞到广州的我
explanation
们国家的
about
国
the
家
suspension
专家
of
组
the
的成员5号
vaccination
先生，他也是
program.
对我们采取相应的这个阶段性的措施，
And
给予了充
actually,
分的解读，大家
yesterday,
也非常安心。 确实我们说有两
we
句
do
话，
have
一个是人
some
不可能差
experts
劲，
from the
两
NHC
两次
arrive
非
in
常合理，变化永远是个
Guangzhou
常态。
City. They
我们
also
整个疫
offer
情
a
防
lot
控，
of
我们每一天每
explanation
一时刻
to the
都在变
public.
化，我们就是与时俱进，我们时时刻刻我们把我们疫情常态化防控中
So
的，
actually, this
特别是
time
当
we
下
have
这
done
个
a
阶
lot
段，
of
我
work,
们当成
and
重要
also
的
we
一
are
个赛跑，
adjusting
我
our
们每一个
measures
重要的举措
to
要
better
及时
contain
地
the spread
做
of the
好它，
virus.
战略和战术能够形成最佳的一个
So
组合。
at this
刚
critical
才张德
time,
斌副主任也一再提
we are
醒，
raised
特别
with
是
the
大家
virus,
所
we're
有的
raised
声
with
音
the
啊，
epidemic.
大家不要有侥
We
幸心
have
理，
to
及时保
adjust
持在这个重
our
点的位置，
strategy
大家还是
in
要做
order
到
to be
少
proactive
减少
in the
减，第二
prevention
就
and
是一致，
control, as
这
well
点
as
非
to
常关键。我
extend
觉得我
the
们只
scope
要
of
是
the
每一个
testing and the
广州的市
screening.
民都能够严格
So
按照
all
相
in
关
all,
指引来
we
做，我
have
相
to
信我
remain
们
vigilant.
在这场疫情防
Still,
控
you
过
have
程
to
中，
mind
我
your
们
own
能够
hygiene,
加快我们
wash
的
your
这个
hands,
步
and
伐。非
exercise
常感
those
谢，好，继续把
regular
这个时
prevention
间
and
留给媒体
control
朋友，
measures.
谢谢大家。
I
好，
think as
第三
long
排
as
这
we
位女士，好
abide
好。
by the general guidelines to fight
我
the
是央广
epidemic,
网记者，想
we
询
are
问一
able
下
to
广
win
州南
this
站的王书
battle.
记。
Next question,
请问
please.
在疫情防控期间，旅客在广州区内的各个火车
My
站
question
内
is to
乘
Mr.
车的话，
Wang
需要
from the
注意
Guangzhou
哪些
South.
方面的问题？谢谢。
好，谢谢央广网的记者。
So for the travelers who are
那么我
in
们
the
铁路
different
部门啊，
train stations in
有
Guangzhou,
这
what
么
are
几个
some
方
of the
面
reminders to
需
these
要提醒这个
passengers?
广大旅客。
Thank you very much
前
for
往
your
广州的火车
question.
站经常乘车有这么几个细节，大家要注意。
For the railway group,
那么
we
首先呢，
need to
要请广大
remind
旅客啊，
some the passengers.
在出行前要及时了解始发地以及你的
You
目
have
的
to
地
pay attention to certain
这个
details.
疫情防控的相关的政策根据这个
First,
政策，你
to
再按
all
合
the
理安排你
passengers,
的出行。那么第二个呢，
you need
还是
to
请广
get
大
some
旅客在乘车
information,
前
especially for the
要及时
policies of your
核酸检
destination.
测之际的这个医疗机构
And
进行核酸
second,
检测，
Before you
并
get
且
on the train,
在乘车前要取得核酸检测
you
的
have
阴性证
to
明。
prepare
因为
the
从昨晚22点到
NAT
现在这
certificate.
段时间看，
And
还是有
also,
少部分旅客
before you
没
get
有
on
核
the
酸
train,
这个
you
证
need to
明，
have this
或者他
negative
做了核酸这个证明
NAT
以后，做了核酸检
certificate.
测以后没有取得这个阴性证
Because
明，
right now we
到车
see
站来
for
做
some
车
of the
那么
passengers
这
they
个
are not
情
able
况
to
我们
provide
都
this
是没有
NAT
办法安排
report.
进站的。那么第三个呢，
Some of them,
还是要
even
请
though
这
they
个
have already
旅客
taken
到车
the
站乘车要预
NAT,
留
but they are
足
not
够的
able to
这个
receive
乘车的时
the
间，
certificate.
就是
If
进
this
车
is
站以后，
the
我们也
situation,
请
we are
人
not
听
able
从
to let you in the
车站的工
train.
作人员的引导，配合做好
And
疫情
also,
防控的
if you are
验
visiting
码、
some of these train
验证、
stations,
测纹等相关
you
的
need to prepare some
那么
time.
进来
For
排队的时候呢，
example,
也
you
请
have
这个
to
旅客要提
go
前
through some
就
of
把
the
这个
security check. We will
提
check your
前
body
打开
temperature, and
这
also
个
we will
并
check the
出示手机
certificate
健
and
康
your
码
green
和
code.
核酸检测的阴性证明那么我们在这个推荐大家就使用我们的微信小程序的月
If
审
you are in
视
the train
这里面的这
station,
个月康码因为这里面呢
you
可以
have
同
to
时显
show
示
the
健康
QR
码
code,
和
the
核酸
health
检测结
code,
果
the green health
主
code,
要的
and
目的呢
also
就
you
是
have
减
to
少这个旅客排队等候
present
的时间就节
the
约时间
NAT report.
那么第四个需
So
要提醒
probably
的
you could use the
那么
Yuekang code,
在进站乘车的时候
and you could show
还是
these
要
two
坚持全程
certificates
佩
at the
戴口
same
罩
time. It will save
不要
some
把
of your
它
time
不要把口
when
罩
you
摘下
before
来
you get on the
这
train.
个交谈聊天这个非常重要同时
And
呢
also
在
after
排队
entering
等
to
候
the
的时候
train station,
尽
make
量
sure that
与
you
周围
wear
的旅
your
客
face mask
保
all
持
the
间
time.
距
Do
这
not
个需要
remove
特别提
your
醒
face mask.
那
This
么
is
最后
very
一个需要
important
提醒
for
的
us.
就从其他地区的火车站
And when you are
到达
standing in the
广州
queue,
地
make
区过
sure
火车
that
站
you
内
have some like
在
social
站内中
distance
转换
with
乘的
other
这部分旅客
passengers.
那就只要
And
你
the
不出
last
站
reminder is,
那么这个还
if
是
you
不
are
需要提
arriving
这
in
个核酸检
Guangzhou
测证明
from other
这个换乘的旅
destinations,
客不需要提
especially you are
核酸
having
检
a transfer in Guangzhou City,
就是这么意
if
思
you are not going out of the station, you do not have
记者
to
提问也感谢我们
present this
广电集
NAT
团广州南
certificate.
站王展新副书记的这个回应，非常温馨，非常仔细，可 可以说是站在大家旅客的角度，
Thank you very much
怎么样更加快捷、更加
for
方
Mr.
便
Wang
做
Zhanxing's
的温馨
briefing.
提示很重要的事情说3遍。
Actually, he gave a very detailed explanation on the reminders for the passengers.
更多的特别搭乘我们火车交通。
It's very important actually for the passengers who need to take on a train. Hopefully, this information can pass to the passengers who need to take the trains in Guangzhou or who arrive in Guangzhou.
谢谢主持人，我是凤凰卫视的记者。那我的问题呢
All
是
right,
想提给
next
白云
question.
机场的戚耀明先生。 想请您进一步介绍白云机场针对这个旅客查验
With
健康
Phoenix
码绿
TV
码，还有包括72小时内的核酸
My
检测
question
阴
is
性
to
证明的
Mr.
一个
Qi
情
Yaoming
况如何？另外
from
呢，如
Baiyun
果说针
International
对
Airport.
近期是确实有这个飞行出行需求
I
的
want
旅
to
客，
understand that some of the measures will be taken by the Baiyun Airport to contain the epidemic. And for some of the passengers, if they need to take the plane to travel outside, what are some of the reminders? Thank you very much for your question. So actually, in my opening remarks, I said from 10 p.m. yesterday to today, we have done a lot of work of the checking. The order is quite good. For the passengers, most of them are able to provide the green code as well as the NAT report. And for the 300 passengers who are not able to provide those certificates, and these people, they may not get notice about this policy. But I believe with this public education, more people will get to know. They have to prepare the green code as well as the NAT report. So I believe in the future, fewer and fewer passengers are not able to provide those certificates. And I still think it is quite safe for you to travel with a plane. And actually just now, the Guangzhou South Station also have the same requirement. So same for me. So you have to prepare the 2 certificate and also you have to wear your mask all the way along. But for the airline travel, it is subject to the adverse weather condition. And in recent days, you could see for Guangzhou City, it has experienced a lot of adverse weather conditions. So for some time, maybe the weather itself is okay, but still, the transportation route is not suitable for the flight. So it is common that we have to cancel some of the flights. So I have to remind the passengers before you depart, please pay attention to the changes of the airline. But you don't have to worry too much. Because right now, if you're not able to take on the plane, you may able to change your flight tickets. So once again, I would like to say it's quite safe to travel with plane. Thank you, Mr. Qi, for your introduction. Today is June the 1st, is the Children's Day. And just now, Madam Pan from Panyu District, she shared with us a lot of touching stories. I think right now we still have to be very stringent in the prevention and control work. So right now I would like to show you a video. It's a very touching video shot yesterday.
刚才我们麦去讲，这是一个我们自己工作人员拍到的一个很自然、很温馨的镜头，就是我们昨天在番禺，我们一所很年幼的孩子，我们是工作人员很辛苦，热天，但是我们几个小时的奋战，我们把所有的这个孩子们这个相关的核酸检测做完以后，孩子们非常自觉的把他们平时的一首歌。
To show their gratitude to the medical workers.
大家看到我们孩子们自然的给咱们的工作人员鞠躬，我们的工作人员也是，我听麦去讲，大家现在的工作人员都是满含热泪啊。
So you can see for these children, they're actually paying tribute to the medics. And also it's quite touching, and you can see for some of these medics there with tears.
So
we do have a lot of challenge for the prevention and control work, and especially in Guangzhou, the weather is quite tough. But still, we believe if we stay united, we are able to conquer the adversity. So that's the end for today's press conference.